Any symptom can be the reliving of a trauma or the reliving of a coping mechanism to protect ourselves from ever experiencing it and avoiding it. So let's take a very controversial example and see what I mean. And the controversial example is addiction. And most people think of addiction really as a coping mechanism, like there's something that's too painful and we have this craving to have love or soothing ourselves. So we become addicted as a way not to experience the pain. And that is true for sure, but it may not be the whole story because sometimes the addiction can itself be the reliving of a trauma. And let me give you a very powerful case that shows this. A woman came in for a severe eating addiction. She compulsively ate and couldn't stop. And we found out that there were two different aspects to this. One was that it was a way of coping with trauma that was about eating, and the other one was the trauma itself was about eating. So we started with her compulsive eating as a coping mechanism, and we found out that she compulsively ate to soothe herself from the pain of something that she didn't even know what it was at first, but she knew that it was awful and that the only way she could do it was to control her own eating, which people do, because then they say, you can't control me and I can control it. And she was giving herself things that she really, were very sweet and she really liked, and using that as a way to soothe herself, which of course then created another problem, which was that she felt out of control and then she viciously attacked herself for that. And when she did that, when she was like attacking herself around eating, and we started to look at the attack, something very powerful happened, which was that she realized by finding the body sensation associated with this, that when she was an infant into being a toddler, she was sadistically force-fed by a nurse without her parents knowing at the time. And so that this compulsive eating also was the reliving of the sadistic nurse forcing her to eat when she had no control over it. And so then when she started to viciously attack herself for the eating and forced herself to eat more, she was not only coping with the eating trauma, but she actually was reliving the eating trauma. And when we took care of both, which actually took us 2 sessions, her eating actually started to get better because we took care of the craving, the soothing herself, but we also took care of the eating as the reliving of an echo of the addiction that happened when she was so small. If you're interested in doing this kind of work, please go to Life Centered Therapy and you can check out you can make a consultation with us, just book a consultation. You can learn all about us at Life Centered Therapy. And if you want to learn how to do this, we can teach you. And if you want to know more about it, we can certainly do that. And read our book also, The 1 Hour Miracle, where you will learn all about this in a really fun way. Thank you so much.